Okay, guys, this is the fourth lecture of the series of guidelines on infection prevention and control by the Dental Council of Ireland. Here we will be discussing about the decontamination of reusable invasive medical devices, which we also call RIMD. So we will be discussing about the dental instruments which we use in operative dentistry, in periodontal surgery or periodontal dentistry, or we will be discussing the instruments which are being used in the oral surgery. So various instruments which we call the uh, reusable invasive medical devices, how they should be decontaminated. What is decontamination? It is the process which is a combination of procedures that include transportation, cleaning, disinfection, and or sterilization used to render a reusable invasive medical device safe for further episodes of use. The most important way of reducing the risk of transmission of infectious agents is by ensuring that the decontamination of all instruments is as effective as possible. Decontamination is performed in a suitable location, ideally external to the dental surgery. We are discussing decontamination. So, cleaning, disinfection, and sterilization. Cleaning is the process that physically removes soiling, including large numbers of microorganisms and the organic material on which they thrive. Disinfection describes a process that eliminates many or all pathogenic microorganisms on inanimate objects with the exception of bacterial spores. And sterilization refers to a physical or chemical process that completely kills microorganisms from an object, including spores. Sterility is an absolute condition. An item is either sterile or not sterile. Local Decontamination Unit, LDU, or Local Decontamination Area, LDA. All current dental practices must have a suitable local decontamination area, while best practice requires that dental practices should have a separate local decontamination unit. The LDA must allow for the separation of clean and dirty instruments, must be clearly zoned, and must be as far as possible from the patient. All new dental premises opened after January 1st, 2016, whether in new or pre-existing buildings, must have a separate decontamination room or LDU and must at least be fitted out to provide for a washer disinfector. Also, a separate decontamination room must be included in the plans for the extension of any existing dental premises into a larger area. All existing practices should, where possible, have a plan to progress towards the establishment of an LDU. Instrument decontamination. All dental instruments must be correctly decontaminated. That means reusable invasive medical devices, including handpieces, must be sterilized after every use. Other equipment like apex locators, vitality testers, or equipment not suitable for sterilization should be cleaned and disinfected in accordance with manufacturer's instructions. Any instrument defined as for single use should be used in accordance with manufacturer's instructions, and then it should be discarded or disposed of safely. Certain important points. Any instrument or equipment needing repair must be completely decontaminated before dispatch to the engineer or to the service lab. All newly purchased dental instruments must be accompanied by manufacturer's instructions giving details of decontamination procedures for the equipment. Appropriate PPE must be worn at all the stages of the decontamination process. New reusable instruments should be decontaminated prior to the first use. Acquisition of the RIMD. When procuring RIMD, it is essential that it is compatible with the HSE standards and recommended practices. All reusable invasive medical devices must be CE marked. Certificate Europe. Reusable invasive medical devices or RIMD cycle. Well, when you acquire it, then you clean and disinfect, inspect, pack, sterilize, transport, storage in the storage area. When it will be used, after it will be transported to the cleaning and disinfection area. So this is a cycle you have to follow. If you feel that if it was like a borrowed one, then after inspection and packaging and sterilization, you can return it. If it is need to be discarded, then you will discard it. The process of decontamination. Step 1, transportation of instruments. Step 2, cleaning and disinfection of the instruments. Step 3, inspection and packaging. Step 4, sterilization. And Step 5, storage. Step 1, transportation of instruments. Handling of contaminated instruments must be kept to a minimum. Instruments should be transported in a secure container if being carried out of the dental surgery. There must be no contact between contaminated and cleaned or sterilized instruments. It is essential not to contaminate the outer part of the transport box. The box must not be overfilled. The transport box needs to be cleaned using a dual detergent or disinfectant wipe. Cleaning and disinfection of instruments, that is step 2. Cleaning instruments effectively is an essential step before sterilization and reduces the risk of transmission of pathogens. At present, 3 methods of cleaning reusable dental instruments are available using a washer disinfector, ultrasonic cleaning, manual cleaning. An automated washer disinfector should be used to clean dental instruments. It is the preferred method of cleaning instruments, although ultrasonic cleaning can also be used, and as a last resort, manual cleaning may be employed. We are discussing cleaning and disinfection of instruments, the step 2. Instruments must not be allowed to dry out prior to cleaning. If instruments cannot be decontaminated within 30 minutes of use, they should be kept moist. Important point. This can be achieved by using a non-linting absorbent pad or gauze and a few milliliters of water or enzymatic cleaner, but no free liquid, in a transport container, or by using a product specifically intended for this purpose and in accordance with manufacturer instructions. The container needs to be a secured box labeled contaminated. If instruments cannot be decontaminated within 24 hours, they should be cleaned in the washer disinfector, bagged, clearly identified as contaminated, and sterilized at the earliest opportunity. If instruments cannot be decontaminated within 24 hours and no washer disinfector is available, instruments should be cleaned in the ultrasonic cleaner, dried, bagged, clearly identified as contaminated, and sterilized at the earliest opportunity. Duck bags, these are the duck bags. They are also available and must be used according to manufacturer's instructions. What are these duck bags? Duck bags are pre-moistened instrument bags designed to maintain a safe and sealed humid environment for the contaminated instruments. Step 3, inspection and packaging. Instruments should be inspected after cleaning and disinfection using magnification and adequate illumination to ensure that they are free of visible contamination and dry. If the RIMD does not pass visual inspection, it must be returned for a repeat cleaning cycle. Instruments should be packed before sterilization, and the date and autoclave cycle number should be assigned. These data should form part of the autoclave performance record. So we are done with the step 3, that is inspection and packaging. In step 3, inspection and packaging, certain important points. After the cleaning and inspection process is complete, the RIMD should be bagged, wrapped, packaging pouches allowed the RIMD to be protected by an effective biobarrier during storage. Unbagged instruments cannot be stored. Seal the bags carefully according to manufacturer's instructions along the adhesive strip. A selection of bag sizes should be available. Autoclave bags must be available in the contaminated zone. Only when the load is ready to be put into the autoclaves does dental staff member label the pouches, packs, and commence the cycle using a labeling gun specific to each autoclave. Labeling gun should be specific to each autoclave. You are not using one gun for all the autoclaves. If like there are several autoclaves in your operatory, no, one gun for one autoclave. The label should record the date, cycle number, and autoclave serial number. The autoclave serial number is preset on the labeling gun. Therefore, a labeling gun should not be used with a different autoclave. I just told you about that, without resetting the autoclave number on the labeling gun. The labeling gun should be kept in the contaminated zone in the surgery or LDU. The label must be legible. If not, the ink cartridge must be changed. The label must be legible. If it is not legible, then change the ink cartridge of your labeling gun. A corresponding label must be placed on instrument track trace record sheet. Step 4, now the sterilization. Sterilization processes must be effective against all known viable pathogens. The method of choice for most instruments is sterilization by steam using an autoclave. There are different types of autoclave, each involving different considerations, but all requiring the application of consistent standards of commissioning, performance testing, like the performance testing and maintenance and validation. The highest temperature compatible with the equipment to be sterilized within a recognized sterilization cycle should be used. All instruments and packs must be dry when you remove those from the autoclave. High quality water should be used, like deionized or distilled, reverse osmosis, etc., as advised by the manufacturer. Always use the manufacturer's instructions. Step 4, we are discussing sterilization. Loading of sterilization items are loaded within the boundaries of the chamber so that they should not be touching the chamber's wall. Items packed in flexible packaging materials in the pouches can be loaded on edge to edge with paper against the laminate or flat on the tray. The directional placement of the autoclave pouch on the tray should be according to the manufacturer's instructions, that is, paper side down or the laminate down. Follow the manufacturer's instructions of both the autoclave as well as of the pouches manufacturer. Load trays loosely to capacity. Closed non-perforated containers do not allow steam penetration and they are not suitable for use. The closed non-perforated, they should not be used. Step 4, sterilization. A Class B vacuum autoclave must be used to sterilize dental RIMD. It is important that systems are in place to record track the sterilization stage of the decontamination cycle of RIMD and to be able to link these RIMD with patients on whom they have been used. You must be knowing, okay, coming from this autoclave at this time of the day, from this cycle, and used on this patient, so that if anything goes wrong, you should be having the proper track record. So the sterilization stage of the decontamination cycle of RIMD, and to be able to link these RIMD with patients on whom they have been used for the track record. Do not overload the autoclave. Space out bags of instruments, placing the bags on their side in a rack or clear side up if on a tray. The universal program, it says 134 degrees Celsius wrapped instrument cycle is the only cycle, 134 degrees Celsius, only cycle that must be used for dental instruments in a Class B autoclave. This is the steam sterilizer record, just to give you an idea that how the record book would be. On completion of the cycle, staff must validate that the cycle reached the required parameters for the required time as follows, like the printout for each cycle must be examined. The dental staff member must highlight the cycle number, the temperature reached, and the time temperature held, that is 134 degrees Celsius, for a minimum of 3 minutes. The instrument track trace record sheet must be completed and should be properly duly signed by that person who is responsible for that. We are discussing sterilization, the step 4. Provided that the cycle has passed, remove instruments and store in a clean, dry location. They may be stored for 12 months if packaging is intact. Important point from exam point of view. Before instruments are removed from the autoclave bag for patient use, the bag must be examined for damage and check that the color indicator has changed. If the bag is damaged or the color indicator has not changed, the instrument must be re-sterilized before use, and the reasons for the failure should be investigated, why it happened. Now, storage, step 5. If the bag is wet, staff should repack and reprocess the wet items. Staff should report issue, arrange a service call out, and ideally take note of the following, like what time of the day are the wet loads occurring, time of the day, second cycle of day, etc., etc., or first cycle of the day or third cycle of the day, where in chamber was the affected bag, top, middle, bottom, front, back, etc., etc. Was the load a typical load or was it light, heavy, or mixed load? Photograph of full load showing pack position, photograph of pack showing the moisture. So over here we are done with our this 4th lecture of this series.